Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the legislature moves ahead with its budget. We'll hear from representatives from the business community, but first, our popular healthcare update. We'll be back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, as always, welcome back, and thanks for watching the program. Well, it's healthcare is always in the news. Joining us is one of the experts we call in from time to time, Dr. Stuart Shapiro. He heads the Pennsylvania Healthcare Association. Doctor, welcome, as always.
Good morning.
All right, well, let's get right to it, as they say. We have a number of important healthcare subjects to get into. As you know, the legislature is deep into the budget, though they're not talking about numbers right now. They're doing some other things. I'll talk to our guests coming up that don't deal with healthcare matters. But we have Medicaid expansion. We have concern for senior citizens and, what should be done to help them. We have this ongoing debate over tort reform. What do you want to start with? I'll let you decide.
Well, why don't we talk a little bit about baseball today?
Oh, baseball?
Where I'm the
We're not
umpire.
talking about football, right?
No, but I'm the umpire, as you
Okay.
know here, and I call balls and strikes, as I call it.
Okay.
While neither the Phillies nor the Pirates are doing well this year, the economy is, and that bodes very well for the state budget and for health care. And I hope it bodes very well for seniors. Let me put some meat on those bones. First, when Governor Wolf proposed his budget, there was a $2.3 billion deficit. And he proposed a budget, in his view, how to fix that. Since then, the economy's really shown some rapid improvement. Tax collections this year, through the end of April, are up almost $600 million better than projected. So the deficit is now $1.6 million.
Still sizable.
Still sizable, but much more manageable.
Right.
And the good news is that maybe we can make seniors this year a real priority. Mm-hmm. The governor, during his election campaign, talked about making seniors a priority. With that, and during his proposed budget, he treated them well, but there's still considerably more that can be done. And we're hoping that now, with the budget deficit being far less, that seniors are not left by the wayside, and especially those frail and elderly seniors who are in nursing homes. Mm-hmm. Let me take it a step below that. The cost for nursing home care has gone up almost 3% a year for the last 3 years. Yet the budget is flat.
Right.
Nursing homes have been forced to cut staff, delay capital improvements, watch things a little bit deteriorate, although the quality has continued to improve. In Pennsylvania, the statistics from the federal government have said Pennsylvania has improved in its nursing homes in 10 out of 11 areas. So quality is going up.
Now, the long-term implications for not making the capital improvements and internally doing the things can ultimately be very harmful, correct?
Correct. And we've got to stop the slide. And so we're very hopeful that the legislature, working with the governor, will say this is the year to start to address some very, very serious issues. Right now, the average cost of care in a nursing home for someone on Medicaid is $23 higher than Medicaid reimburses. And while I don't like to say nursing homes lose money on Medicaid, what they don't have is reimbursement that covers the cost. Now's the year, with the budget deficit shrinking, to say let's give 2.5% increase to nursing homes. If the government were to say we'll spend $36 million out of a $30 billion budget, $36 million more, that'll bring in close to another 40 of federal dollars.
Right.
So it's a two-for-oneer, where the federal government will help pay to support our seniors. And all I can say is I hope that as the budget deficit decreases, as the economy improves, that the elderly, especially the frail elderly who need care, receive some of those dollars.
All right, we're chatting with Dr. Stuart Shapiro, and we come back to a couple of other aspects of this that I want to talk to him about. We'll see you on the other side of this break.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Dr. Stuart Shapiro joins me. He heads the Pennsylvania Healthcare Association. We're giving you a quick healthcare update, which we do try to do it monthly, bring in a healthcare expert to talk about a variety of healthcare things. We have, Dr. Shapiro will correct me, I think the fourth largest senior population in the country, large seniors, particularly living in rural areas, although they live in urban areas as well. We tend not to think of the rural healthcare needs. All right. As a way to get into the cost of this, some of it has to do with liability and tort reform and the relationship between plaintiff lawyers and physicians and hospitals and other folks in the medical community. Where does all that stand? From time to time, we like to do an update on that.
Well, Pennsylvania has some of the best hospitals, some of the best nursing homes, some of the best doctors in the country. Yet, lawyers come from out of state. In fact, recently, there have been two law firms, one from Florida, one from Mississippi. They fly to Pennsylvania and they place lots and lots of ads. And I'll give you an example.
I see them on TV.
And you see them in the newspapers. And one law firm has put in 30 full-page ads since January 15th against nursing homes. And there's also ads against doctors and hospitals, but let's talk nursing homes for just a second. They've placed over 30 ads. Some of these are against nursing homes that have been deficiency-free for 3 years. In fact, there's one in the eastern part of the state that won the award 3 years in a row from the state health department as one of the best nursing homes in the country, and is loved by its residents. The staff is committed, yet they're tasting out full-page ads. These are law firms from the South who fly up here because of the environment for frivolous lawsuits. Now, then what they do is they put investigators in the parking lot of nursing homes or doctor's offices or hospitals.
Are these fishing expeditions?
Oh, they're 100% fishing expeditions. Then they file lawsuits. Then they don't even want to take the cases to court. They go to the insurance companies and they say, we'll settle it for X. And the insurance companies say, okay, we'll settle it because they don't want to risk punitive damages in some of the courts. So they settle these cases. People who work there go into a supermarket and people come up to them and say, what's the matter with your nurse where you work? Makes the employees feel bad. There is no justification for bad care. And lawyers ought to be able to sue doctors or hospitals or nursing homes.
If there's bad care.
If there's bad care. But when care is good, for out-of-state lawyers to blackmail the health care providers in the state only raises the cost. And when you look at these costs, we talked about Medicaid last year, in 2013, $91 million was spent by nursing homes in order to defend and pay out settlements. That's $91 million that could reduce the cost. Those are dollars that aren't going to patient care. They're not going to providers of care. They're going to out-of-state predatory lawyers who come to this state. And we are hopeful. The business community is hopeful. The healthcare community is hopeful that the legislature will address this issue
Now, they
in the
made some
upcoming
changes
months.
a few years ago. You want additional changes,
They
correct?
made some changes, and one of those changes was very helpful. It said there's going to be a cap, not on damages, but on punitive damages for physicians.
Right.
Once that happened, the number of lawsuits against physicians went boom.
Yes, I read about it just in the press recently.
Right. Those same protections don't exist for nursing homes today. So it eliminated the frivolous lawsuits when it happened against doctors, but still there's cases against doctors. And there was one in that same article that I'm sure you read about a $10 million settlement against the doctor who made a mistake. And those ought to be there. But the frivolous lawsuits that just gobble up the state's Medicaid dollars at a time when we don't have that, where the money doesn't stay in Pennsylvania, a big piece of it goes to these predatory law firms that take 50%, 40% of the settlement dollars, goes into their back pocket and leaves Pennsylvania. And that's just wrong.
Okay, well, look, thanks for coming in. We'll see you next month for another one of our healthcare updates. All right, we'll see you. We're going to hear from the business community. It's a busy week in the Pennsylvania legislature. We'll check in with representatives from the business community on the many issues in the legislature. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Welcome back to the program. Well, the Pennsylvania Business Council is on this segment. This is what we call our Business Roundtable. Joining me, as often is the case, is David Patti. Dave Patti to me, I've known him for a long time. He's the president and CEO of the Pennsylvania Business Council, and the chairman. We got the chairman here, Scott Rogers. Welcome, both of you. All right, you know, Dave has been on the program a good bit. We've talked a lot about legislative matters, Scott. But I don't know that we've ever talked about what's the whole purpose of the Business Council. I mean, we have representatives from labor and business, and, you know, we have a variety of views. So what's your deal, as they say?
Well, in the simplest terms, Terry, well, I want to say, first of all, we have one of the hardest working people in Harrisburg sitting next to me here.
This guy right there?
Yes,
this guy?
no, I'm very fortunate to be working with him. And 1 week on the job here, I guess you might say. So the Pennsylvania Business Council has been around since 1979. We create a forum through the roundtable where CEOs and senior executives are able to come together in a peer-to-peer format and be able to discuss issues that are relevant to their businesses, specific to growth, the climate within the state of Pennsylvania, from taxes, legislative issues, other items of infrastructure that are affecting their ability to hire, retain, and grow their businesses. In addition, what we do is we look at policy decisions in other states and see whether or not...
So broader than just Pennsylvania?
Well, yes, we do, because a lot of our members are also doing business in other states.
Right, sure.
And we have even international business operators that are part of the council as well. So what we're looking at is good public policy and working with legislators here in the state of Pennsylvania to see how we can implement that type of policy within the state.
Job creation.
Right, job creation is what it's all about.
Yes.
How do you
huge.
grow the jobs that everybody says that they want to have in the state of Pennsylvania, and how do you make this a great place to live and work, and where people want to start new businesses? You know, it's great to keep sustaining those businesses that we have, but we have to keep innovating.
Yeah. Well, let's talk a little bit about, you know, legislature is now getting down to serious business. This week, property tax reform, medical marijuana, pensions coming up. These are huge issues that affect not just the business community, but virtually every Pennsylvania Pennsylvania. Let's break them down, Dave. You and I have talked in the past about property tax reform. It looks like it's something that Republicans and Democrats can agree on.
Well, I mean, we've always agreed that we don't like the system that we have. We've never agreed what we want to do next.
Good point.
And this goes back 40, 50 years.
Yeah.
You know, 30 years ago, we had a special session on property taxes. 20 years ago, we had a special session on property taxes. And there's only so many places you can go to get the money. It's $14 billion of real estate taxes that go to education. The problem for the business community has been that often it's been a tax shift from residential property owners to the business community. And to some degree, we're seeing that again in that the personal income tax increase is also a small business tax increase. So it doesn't hit our members quite as much.
If you have a subchapter S corporation,
partnership, LLC.
Now, you're not one of those, are you?
No, we're not.
I didn't think you were. Go ahead.
So they're going to see their taxes go up 20%. And in other states, they get operating loss deductions, they get bonus depreciation, things like that. We don't do that in Pennsylvania.
Yeah.
So this is a tax shift.
But it looks like that the House just passed it this week, bipartisan support. It goes over to the Senate. Now, you're an expert on
We'll see. I mean, the Senate has had less of an appetite for it.
Yeah, I think that's true.
But then again, the Senate is pushing pensions, as you said, this week. And the Pennsylvania Business Council thinks that we have to deal with the public sector pensions for state workers, teachers, and municipal employees.
What issue, of all the issues that are on the table now, would you say is the top priority? I know I just asked you a tough question.
Yeah, it's
business tax cut, the corporate net income tax is.
Well, I think you can put so many things on the table right now, Terry, in regards to the issues that are affecting businesses. I know that the discussions that are certainly at the forefront right now are pensions. We believe, as our members have had discussions, that, and we've brought experts in to talk about this as well, is that pension and pension obligations we have on the state and the local level are going to be here for some time unless we address it and address it properly, so it has sustainability.
So pensions, as we keep talking
and pensions
about,
are so interrelated. As Scott talks about the other issues.
Yes.
If you can't fix this big cost driver, 62 cents of every new state dollar going to pensions, then whether you want to spend more money on something or give a business tax cut, you can't do them both.
Yeah, and the real quick point is that we realize, even with the reform, that there are obligations that have already been made. We're not trying to undo those obligations. We just want to go forward with the right choices.
Okay. All right, when we come back, there's also the corporate net income tax. Governor Wolf has proposed it's 9.99 or 9.95. 9.99, and he wants to reduce it over the next couple of years. We're going to talk about some other interests the business community has, and we'll talk to you after the break.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
All right, welcome back to our Business Roundtable. Chatting with Dave, Patti, and Scott Rogers, are both officials of the Pennsylvania Business. I like that, officials of the Pennsylvania Business Council. All right, Scott, your organization is involved in sort of rating. How do I put this? In a scorecard in which you talk about what competitiveness, job growth. What's that about?
Well, again, the roundtable, we have discussions about what are important to the members of the roundtable. And what we do is we set indicators that can be properly tracked across the state lines and look at what our business climate looks like and how we compete against other states so that we can draw businesses into the state of Pennsylvania. And if there are areas that we are behind, that we're not at the level we should be to be able to attract those businesses, then we go into the legislative lobbying efforts
Try to get it,
try and get
get it
people
done
on
that
our
way.
side to be able to move the needle. And we believe that by doing so, by bringing businesses in here, we can do things like expand the revenue base. The issues that are being discussed right now is increasing taxes. It's not an issue of increasing taxes as much as it is creating a competitive environment in the state of Pennsylvania, expanding the revenue base. And if we can do that by showing how we compete with other states, lowering some of the barriers to entry to be able to do business here, then we can increase that revenue and address some of the issues that we're talking about today.
Dave, you've been following the legislature for a long time, and I'm going to throw you a curve. I always do. I can't throw you a curveball. You know what you're doing. Explain this to me. What are they going to do?
What are they going to do?
We've got pensions, we got property tax, we got the corporate net
well, it's
income
interesting
tax.
the overlap on all of these things to what Governor Wolf laid out on March 3rd in his budget address. So I think the good news for Pennsylvanians is that all of your public policy leaders and policy makers are coalescing around kind of the same agenda of we have to do something about pensions, we have to do something about property taxes, we have to do something about state spending, and even tax policy. As you had said before the break, that the governor has talked about reducing the corporate net income tax. Now he wants to also impose something called combined reporting, which broadens that base tremendously. So it may not be the tax.
So what happens is
out
you get rid of one tax, but your argument is
you change the tax rates. But the good news is that we're coalescing around something. By June 30th, the question is, can we get to some agreements on some of these things?
So here's the big question, and maybe we're going to have Senator Corman on. He's the majority leader in the Senate. He says, if we don't do pensions, don't talk to me about any new revenues, right? You've heard that too, right?
Well, again, I mean, and I think Senator Corman makes a great point that pensions are stopping us from doing anything else. So not just politically, but fiscally, if we don't get those costs under control, we can't cut taxes, we can't increase spending for education, we can't do other things.
Go ahead.
Well, on top of that, there's been discussion about an obligation bond and just kicking a can down the road. It's not an issue of kicking the can down the road. It's about addressing it and addressing it properly so that the people that are in the system know exactly what to expect. We think that that's fair. But the business community that participate in the roundtable, overriding consensus is that the obligation bond is not the way to go.
Yeah, the point is the governor wants to do bonds as a way to help pay off the debt, pay less interest. The other thing he wants to do is the Wall Street hedge fund managers that make, what, 500 or 600. There seems to be more consensus on that. Am I wrong?
Well, so I think, anybody who doesn't go and try and get a better price.
It's like refinancing.
It's low-hanging fruit.
It's like refinancing your house, right?
Exactly.
If you can get a better interest rate.
You still owe the same amount of money.
Yeah, you still owe the same, but you're maybe paying less. I get it. I'm not convinced that any of these plans, we're out of time, get to the heart of it, but we have plenty of time to talk about that.
Sure.
As always, thanks for coming in.
Thank you.
All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.